This next technique is called hacking, and what we're going to be doing is we're going to be using the ulnar side of our hand, and we're just going to be like this. Make sure your wrist is totally relaxed, and not on the kidney region, of course, not in any bony areas. Works really good right up in the traps. And just start kind of light to start off with.
This little technique, what I'd like you to do is take your thumb, depending upon where you're having the headaches, most of the time will be in the back. I want you to go behind the skull and rub in little circular motions. And as you're behind the skull, you'll feel areas that are very sensitive to your touch. I want you to rub that in a circular motion for 3 to 5 seconds. Go to the next point, 3 to 5 seconds. Go below the skull, 3 to 5 seconds. Work along the muscle, 3 to 5 seconds. Keep moving the thumb around into different points around the muscles, and what that will do is that will stimulate the body. It will reset the muscle spindles from the brain back to that area. It will increase circulation, increase blood flow, and reduce the nerve irritation, and hopefully will help take away a lot of your tension headache that you're experiencing.
To mobilize the thoracolumbar junction, place the foam roller on your back. While sitting up, lean back onto it, using the foam roller like a fulcrum. You can pivot from side to side, get the paraspinal trigger points, holding each trigger point for 20 seconds, 5 to 6 times on each trigger point to release them. Trigger points are like noxious areas in the muscle. When you massage them out, it releases toxins. Make sure you drink lots of water and then flush out the toxins.
I've recently been using this sartorius stretch and it hits the spot absolutely perfectly. Let me show you. Okay, so we'll start in this 90-90 position. From there, if both knees are pointing to the left, then we'll lean back to the left and support yourselves on the left elbow. Now, this bit's important. Clench your butt and push your hips forwards. From this position, you should feel that if you're tight through sartorius, your knee will start to lift off the ground. Same can be said if you're tight through muscles like tensa fasciae lata. And if we work to pull the knee down to the ground, you'll start to feel a stretch across the front of the thigh.
And then we'll move into the back part of the ankle as well. Now you've got ligaments and tendons around the back here, and these can often get tight and cause issues as well. So what my favourite techniques for those is in this position here, using a thumb, working up and down on here. Have a go with that one. And there's a corresponding spot on the lateral aspect of your ankle. To get into this position can be a little bit tricky again, keeping in mind the hip. So I like using your right hand just down in here and rubbing up and down in there. How's that feeling there?
Yeah. typically when patients come in and they are complaining of some sort of knee discomfort or limitation in mobility of the knee, I will usually find some sort of adhesions within the soft tissue surrounding the knee. So here you can see me actually just scanning the quadriceps. I'm coming out laterally and I'm scanning around the iliotibial band. I will also use a smaller instrument to get on the medial side of the knee and come around the proximal tibia.
Right here. I want you to take your head to your left side. No, don't lift it up. I want you to just, wait a minute, he's anxious. He really wants this technique. I'm going to just gauge in here. I'm going to slightly push down, and I want you to either roll your head to the side first and see if you can get a stretch through here. So now you can do it. And you let me know if you feel any stretching taking place. Right there. So just hold it and breathe. So I've got a little bit of traction over here. And my client gets to do the rest of the work. And when it feels like it's released, see if you could take it further into that movement. Nice and slow.